Dr. Rafeyan, I have a question for you. There are times where I kind of see this peculiar over-adherence to antidepressant monotherapies, one after the other, the endless switches in clinicians. And when I ask them, when I have the opportunity to ask them, well, why not think of adjunctive treatment strategies, whether off or on label earlier, their response is because I'm waiting for that partial response to happen to go down that route. If I don't get a partial response, what's the point of keeping the antidepressant on board? Why not just switch? What would be your response to this?
So actually that's more the, what you brought up is more the reality that happens every day. I think we have just been programmed to think that we need to get a partial response before we add a atypical antipsychotic that has indication on. For a number of reasons, but again, I think part of it is the myth and maybe a stigma against the name of the class of medication as an antipsychotic. And many clinicians are concerned that I don't want to expose patients to potential side effects of an antipsychotic, forgetting the consequences of lingering symptoms of depression.
Right.
And that is, I think it's just we have to make a paradigm shift in the way we think as clinicians, because the numbers show that we really just 10% think about utilizing adjuncts. And again, data shows that switching is not going to go anywhere. And I usually encourage our clinicians to actually put themselves on the patient's shoes and look at that journey that the patient goes through. For example, if I am depressed and I go see you, you may prescribe me usually an SSRI, give me 2 to 3 weeks, ask me to come back in about 3 to 4 weeks usually. If I'm getting a response, great. But if I'm not, but 50% chance that I'm not, then you're going to optimize the dose. Give it another 4 weeks. So at this juncture, it's 2 months. Okay? And the chances of me getting a response by increasing the dose is actually lower. And then you decide, okay, now I will change your antidepressant. So maybe I'll go from an SSRI to an SNRI, broaden the spectrum. You go through the same process again. And the chances of getting a response at that point came out of STAR-D is about 27% at best when you switch. Which means 70%, I'm going to come back 4 months down the road and I'm still depressed. That's a long time of suffering with a disease that has significant consequences.